Dr. Lee Engel here with Upper Cervical Health Centers with part 3 of our 4-part anxiety series. So in part 1, we talked about how prevalent and some of the options for anxiety. Part 2, we talked about some internal factors that can be affected. So I want to throw in one more internal factor, and then let's talk about where I might fit into this puzzle. So one of the other things that sometimes you'll find, and maybe they don't even realize it, but if you do enough testing, you can bring it out, there are balance vestibular disorders can also create a problem with anxiety. Our brain and our system has to use an enormous amount of energy and focus so that we're upright. I can stand, I can walk, I can lean on 2 little feet, and I don't fall over, right? Things we don't really think about, but we're able to do. If there is dysfunction or a problem in that system, your brain gets almost like this, right? Like it gets a little worried, it has to work harder, it has to do more to keep you upright, and a lot of times there's a big, long neurological pathway. I'll be glad to draw it on a whiteboard, but short and sweet is, if that's off, it can drive anxiety. So if we don't fix that balance or that vestibular issue, we'll also find that we can't get rid of the anxiety. So here in the office, the big things I focus on are, I want to look at the very top of your neck, the top 2 bones up here. They have a big impact on one, if you get proper blood flow to your brain, which we all know proper blood flow anywhere is critical, and a lack of that will cause some of these problems to start, that we're getting proper input and nerve input into the digestive system. But most importantly, that fight or flight that we talked about in the earlier video, the brain stem is really what controls that. We've got the brain, we have the tail end of the brain. It drops down in the top 2 bones in your neck just a little bit. Something happens, those get twisted and turned, they start to put pressure on there, suddenly that brain stem is going to malfunction. And if I malfunction, I'm really not going to wave and wander with those fight or flight or rest or digest very well. I tend to get thrown all the way into one of them. So if we don't remove that pressure, and that's what we do here very well, very specifically, no twisting and turning, but if we don't get that pressure off of there, all the other things really aren't going to work out very well. It's not going to matter what we do. So we figure out if you have pressure on your brainstem. If you do, we figure out what we need to do to remove it. Once we've done that, then we can look at all the other factors. Are there dietary changes we need to make? Are there supplementation changes we need to make? Is there balance therapy that we could do at home that might help correct some other things? But the core problem is we've got to get that pressure off the brainstem, then we'll lay out a plan and look at everything else.